I'm Dr. Vaishnevi. I'm going to examine your blood pressure. Your name, please.
Propulsion.
Age.
20.
Have you taken any caffeinated drinks or smoked or done any exercise in the last 30 minutes?
No.
Okay, let's start after 5 minutes.
Okay.
I'm going to measure blood pressure. Is that okay with you?
Yeah.
Can I raise your sleeves?
Yeah.
Palpate the brachial artery to confirm a viable pulse. Can I wrap this around your arm? Is that okay with you?
Yeah.
Palpate the radial pulse and inflate the cuff until the radial pulse stops. The pulse stops at 120. Position the stethoscope diaphragm over the brachial artery. And place the cuff by adding 30 to 120. And deflate slowly and listen for pulse sounds. The Kolkov sound is heard at 100 is systolic pressure, and muffles and disappears at 70 is the diastolic pressure. The blood pressure is 100 by 70 and is normal. If you find blood pressure more than normal, that is more than 140 by 90, check both arms for accurate reading.
Start first by washing our hands.
So I made her stand away from the Snellen struck, which is on the opposite side of us, and she's 20 feet away from the Snellen struck. And now I'll say her, like, look here, you have to place the cow on one eye like this and read the letters written. From small to big, big to small, yeah. Start. So the visual acuity is expressed in two numbers. The first number indicates the distance of the patient away from the chart, and the second number indicates the distance at which the normal. Now we'll check her visual field. So in order to check her visual field, I'll ask patient to follow my fingers with their fingers. I'll place my fingers 2 feet away from her and tell me yes or something when you see the fingers in your visual. Yes. 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 So her eyebrows, they are normal. And now I'll check for the sclera and conjunctiva. So her sclera is white and conjunctiva is pink, so I guess that's normal. And now I'll check for any tenderness here on the side of the nose or any lateral duct. Now we will check her sclera.
So it's cornea and lenses.
By placing with the help of the dim battery light. Her sclera is normal and her lenses are normal. Now we'll check her pupillary size. Pupillary size, we use a pupillary size table. So we'll check the pupillary size. It's between 3 mm to 5 mm. And now we'll go for pupillary light reactions and near reaction. Now we'll check the iris. We'll check for if we have any shadows. And now with the light reaction, we'll dim the lights and we will say the patient to look at a distance, and we will place the light obliquely and see the constrictions in the eyes of the patient. And now, to conduct the near reaction, I'll ask the patient to look at this object constantly, and I will notice the constriction in her eyes and the convergence in her eyes. Now, in order to continue with the convergent test, I'll ask the patient to follow their gaze to this pin and tell me that you see this object as true.
Yes, now.
You see it as single as now? I'll tell the patient to follow my fingers, and I'll play a big edge or wide edge in the air, and the patient's gaze will follow. Now, if we find her movements were normal, but if we find any lid lag defect, we can follow lid lag test. I'll ask the patient to look at my finger and continue their gaze with my finger.
Darken the room. Switch on the ophthalmoscope. Place yourself 15 inches away from the patient. Place thumb of your hand across the patient's eyebrow. Move in the ophthalmoscope on the 15-degree angle towards the pupil until optic fundus is visible.
For inspection of the auricle, we shall first inspect each ear and the auricles and surrounding tissue. If there is any deformities or any discharge or redness or any swallowings in that place. Second, for inspection of the eardrum and ear canal and drum, with the help of otoscope, we'll gently move the auricle. The tympanic membrane is firmly white, and hyperemic myocarditis is intact and perforated. Next, for whispered voice test, we'll hold the patient one arm length and we'll whisper some combination of alphabets in one ear. We'll do the same for another ear too. CD. He can hear the voice, and so he is not positive for whisper voice test, and it is used to evaluate the conductive hearing loss. So for that we'll use tuning fork, and we'll place the conductive tuning fork on the mastoid bone and outer side of the ear. So on which side you feel the more loudness, on the mastoid bone or outer side of the ear? Outer side of the ear. So his bone conduction is lesser than air conduction. So he in this it indicates that he is not potentially conductive deafness. Next, we'll use the tuning fork and we'll place it on the forehead and vertex. So the conductive tuning fork is placed on the forehead and on the vertex. So can you hear the hearing was on both sides, equal on both sides or not?
Equal on the both sides.
Equal on the both sides, right?
Hello, I am Shreyash, and I will do a physical exam for nose and mouth, during which we will go through certain key points that will act as a base of this physical exam. Your name and age, please.
Indra Shukla, age 25.
Today we will inspect nose and mouth. Are you comfortable?
Yes.
In case you are not feeling uncomfortable, you can tell me.
Okay.
So now we will check the inferior and anterior surface of the nose. And the symmetry of the nose. So there is no asymmetry. Now we will check the vestibule. Please breathe. Again. Looks good. Now we will check the nasal septum, nasal mucosa by otoscope using the longest spatula. Handle the device with proper care. So as we can see, there is no tenderness, no epistatis, no bleeding and no nodules. Now we will check for frontal sinus and maxillary sinus. Ask every time whether the patient is comfortable or not. So there is no swelling or tenderness. Now I will start the examination of mouth. Please open your mouth. Using the tongue depressor, I will check the oral mucosa, interductal papillae and gum margin. Looks good. No swelling, no ulcer and no change in color. Yeah, good. So now I will palpate your teeth and check for any loose teeth. Touch the teeth softly. All teeth are intact. Now I will inspect the hard palate, tonsil, pharynx and location of the ulva using the tongue depressor. As I can see, the ulva is in the midline and color of the palate is also normal. So this looks fine. Now I will begin with the inspection of the tongue. Please put out your tongue. Hold the tongue softly. Now we will look for the color and symmetry. The surface of the tongue will be rough due to the papillae. So according to the inspection, the tongue looks good.
Hi, I'm Vimal Yadav and I'm going to do oropharynx and neck examination on you. Can you please tell your name and age?
Hi, my name is Vaishnevi. I'm 35 years old.
So first of all, we're going to do an oropharynx examination over you, and before that, I need to wash my hands, and then I'm going to need a torch, and then a tongue depressor and gloves. So can you please open your mouth for me? A little bit more, and put your tongue out. Now I'll be needing a tongue depressor to see through. Can you move your soft palate behind? You'll be checking for some white marks over the hard palate, and you have to see when the patient is moving his soft palate, the uvula is in between and both the portions are not red. You have to check for the redness inside, and it looks fine to me. Thank you. So now I'll be performing the neck examination. So the first part is I have to check the patient's head, and I'll be looking for symmetry, that is from posterior, anterior and the lateral sides. Here I am looking for some unusual long or shortness of the neck, and it looks fine to me. And then I'll be looking at how the patient carries his head. Either it's tilted or rotated, and now it looks fine to me. So now we're going to palpate the neck, and we will be looking for the masses. And if we found some masses, we have to check for its mobility, its consistency, and everything. So the regions we'll be looking at would be the spinal cervical. For that, I have to ask the patient to move his head down and to palpate. Now we have to check and come up for the mastoid process, trapezius, and then we will get sternocleidomastoid. It all looks normal to me. So now we will be checking on the trachea part. For that, we have to palpate the trachea for any deviation from its usual midline position by placing your finger. You have to place your index finger and the thumb finger to look for any deviation. And look for the space between it and the sternocleidomastoid. And you have to repeat this process from the other side too. And you look for the movement of the trachea if it's unusual or something. To me, it looks symmetrical. So now we'll be looking at the lymph nodes, and for that we'll be using your second and the third finger pads of your index and the middle fingers to move over the skin of the underlying tissue. So the first one is the preauricular, preauricular lymph nodes. Then you will posterior auricular. Then you have to look at the occipital, that's at the base of the posterior skull. We'll be looking at the tonsillar, and the last is submental. Superficial cervical, posterior cervical chain, deep cervical chain, and then supraclavicular. So now I'll be inspecting the thyroid gland. For that I will be inspecting the anterior lower half of the neck. Now I'll ask the patient to have a sip of water. As he's swallowing the water, there is an ascending mass in the middle and behind of the sternocleidomastoid. The thyroid gland, thyroid cartilage and cricoid cartilage, they all normally rise as the person swallows.
Hello, my name is Surryavanshi and today I will be performing the physical examination on the posterior chest. Before proceeding with the examination, make sure you wash your hands properly. For the examination of the posterior chest, you have to stand in the midline of the patient's back. Inspect for any deformities or asymmetry. Any impaired respiratory movement, take a deep breath, or any abnormal muscle retraction. Can you put your hands on the opposite shoulders? Okay. Sit straight. Now, the second process is the palpation. Test chest expansion. Place your thumbs at about the level of the 10th ribs, with your fingers loosely grasping and parallel to the lateral rib cage. As you position your hands, slide them medially just enough to raise a loose fold of the skin between your thumbs over the spine. Please inhale deeply and exhale. Continue this. Watch the distance between your thumbs as they move apart during inspiration. Inhale, exhale. And feel for the range and symmetry of the rib cage as it expands and contracts. Inhale, exhale. Palpate both lungs for symmetric tactile fremitus. Whenever I touch you, you have to say 99.
99, 99, 99, 99, 99.
The next step is percussion. In this, the distal interpharyngeal joint of the middle finger of the left hand should be placed on the chest wall, skin of the chest wall, and make sure that all other fingers are not touched to the skin. You have to move in a lateral position and vibrate it with the right hand middle finger and hear the vibration. If the vibration is normal, that is resonant. Put 2 strikes on each point and notice the vibration. Okay, so the last step is auscultation. It is a technique for assessing airflow through the tracheobronchial tree. You have to listen to the breath sounds. Listen to at least one full breath in each location. Take a deep breath and exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. I can hear vascular lung sound that is soft and low pitched. Thank you very much.
Hello, doctor. Can you please lie down?
Yes.
Right.
Now I am going to determine jugular venous pressure. First I am going to inspect your jugular vein and check for the highest point of oscillation. Can you please turn your head to right and left? Now I am going to place ruler on sternal angle and cut at the highest point of oscillation. Measure the distance. For the above distance, add 5, which is distance from right atrium to sternum. Now add all the calculation and tell to the patient the GVP is 6 centimeters of water. Normal range is less than 8 centimeters. If it is more than 8 centimeters, then it is abnormal. Now I am going to inspect carotid pulse for amplitude and counter. We can check for carotid artery medial. Now I am going to inspect carotid pulse for amplitude and counter. We can check for carotid artery medial to sternomastoid muscle at level of cricoid cartilage. Inspect carotid pulse for both sides. Now I am going to palpate carotid pulses for pulsation count. Now I am going to auscultate carotid artery for any bruits and thrills on both sides. Now can you please hold your breath for a while? I will auscultate again. Now I am going to inspect pericardium for any vibrations and masses and discoloration. Now I am going to palpate for yields using my finger pads. Now I am going to palpate for thrills with balls of my palms. Now I am going to put my 4 fingers just below the nipple to check for impulse. Location 4 feet to intercostal spaces, mid-clavicular line. Diameter less than 2.5 centimeters. Amplitude breaths and tapping. Duration it lasts through first 2/3 of systole. Now I am going to auscultate for S1 and S2 sounds at auscultating areas of R. S1 mitral plays tricuspid closing sounds. S2 aortic plays pulmonic valves and close sounds.
Auscultate of aortic, second interstitials. Auscultate of pulmonary, left second interstitials. Right ventricle, tricuspid. Left ventricle, apex of heart. Left ventricle mitral, 3, 4, 5, left sternum, column. Now I am going to assess the pulses. First I am going to assess the radial pulse with the right thumb. Now I am going to assess the brachial pulse, medial and the anterior cubital fossa. Now I am going to assess the carotid pulse at the level of cricoid cartilage. Now I am going to assess the dorsalis various pulse on dorsum of foot. Now I am going for posterior tibial and posterior malleus. Now can you please stand up? I am going to check for any pitting areas. Check the dorsum of the foot. Check on medial malleolus. Press with index finger. Check over shin bone. Press with index finger. I did not find any fittings and edema. Your cardiovascular examination was done. Thank you for your cooperation.
I'm P.K. Bhavtam. Today I'm going to do the abdomen examination. Is that okay with you?
Yes.
For this, I need you to take off your shirt. Is that okay with you, sir?
Yes.
Okay. To inspect the abdomen. The abdomen is symmetry. There is no scars. The skin is normal. There is no lesion. The umbilicus is inverted. There is visible pulsation in the epigastric region. I will observe is there any bulging flanks and dilated blood vessels. There is no pulsation outside of the epigastric region. Palpation. I'm going to listen the bowel sound. I can hear the gurgling sound. Now for fruit sounds. Aorta, renal arteries, iliac arteries, femoral arteries. There is no root sounds. Percussion. We'll do the fluid wave to check if there is any sign of ascites. Can you hand like this?
Okay.
Do the shifting dullness. Sir, can you turn to the left side? Do kidney punch at the costovertebral angle to check for kidney enlargement. Do you feel any pain?
No.
I will start with the palpation. First, I will go with the light palpation. Do you feel any pain, sir? With the deep palpation. Do you feel any pain, sir?
No.
I will do special maneuvers to test for localized peritonitis. First, I will go with the rebound tenderness. Do you feel any pain, sir?
No.
Now I will do with the roughing signs. Do you feel any pain, sir?
No.
Do with the shower sign. Sir, can you flex your thigh against my resistance? Do you feel any pain?
No.
Okay. Do with the observator sign. Do you feel any pain, sir?
No.
In
I have a friend as a patient, so we are going to examination for liver and spleen. The spleen generally not palpable in the healthy adult. The pathologically enlarged spleen is palpated under the left costal margin during as the inferior edge descend to the examiner fingertips. In case spleen is already suspected, palpation should be begun further down. The examination may be facilitated by genetically lifting the left flank of the patient vertically. Examination of liver. Clinical examination of the abdomen should be always include precaution palpation and optionally auscultation of the liver. Palpating on normal size liver is often difficult. It usually extend beyond the rib cage in the area of the scratch test. Although its reliability and the precaution remain controversial, one method is place the stethoscope on the chest just below the xiphoid process. Lightly scratch the abdominal skin in the right lower quadrant. Fingernail parallel to the expected liver border at the air-filled bowel loops under the fingertips poorly transmit the sound waves to the stethoscope. Proceed with the scratch test.
Hi there, my name is Ashwini. I'm a medical student. Could you please confirm your name and age for me?
Sure, I'm Abhinav and 20 years old.
Nice to meet you, Abhinav. Today I have been asked to examine your shoulders. This will involve just looking at the shoulders, then feeling around shoulder joints, then just assessing the movement of both shoulders as well. Would that be okay?
Yeah, fine.
Brilliant. Do you have any pain at all before we begin?
No, I don't.
Fantastic. And if you could just take your t-shirt off for the examination as well, and we'll get started.
Okay.
Okay, Abhi, it's time to assess the movements of your shoulder joints now. First of all, if you could raise your hand in front and over. Now, can you move your hands behind? Now, raise your hands out to the side and rotate. Now, close your arms in front of your body. Place your hand behind your back to touch the shoulder blade. Rotate your arm towards the ceiling from the shoulder level. Very good, and relax. Okay, Abhi, I'm gonna move your arm for you now. If you just stay as relaxed as possible. Please let me know if you have any pain at all. Do you feel any pain?
No.
Okay, now bottom of the scapula from behind. I need you to resist me. Do you feel any pain?
No.
Excellent. Hands up. Then press against my hand. Any pain?
No.
I would like you to turn around like you are holding a bowl of soup. Go ahead. And I'm pressing. Any pain?
No.
Now fully abduct your arm to the shoulder level. Drop it slowly. Any pain?
No.
Maybe that completes the examination.
Hello, my name is Ashutosh Modak of second year medicine student. May I know your name and date of birth, please?
Hello, my name is Pinaki Modak, date of birth 11/1/1968.
Okay, thank you. Today I am here to examine your wrist and hand. May I proceed with the examination?
Yes.
Okay, before proceeding with the examination, I will be sanitizing my hand. So, at the beginning of the examination, I will be inspecting your hand. May I proceed with it?
Yes.
Okay, first keep your hand like this. Okay, great. Can you turn it over? Okay, now I will be palpating your hand. So, may I proceed with it? Okay, now I will be proceeding with further examinations. So, the further examinations require the range of motions and the special technique. So, may I proceed with the examinations?
Yes.
Okay, now place your palms like this and close your fingers like this. Open it, close, open. Okay, do you feel any pain or do you have any kind of pain in it?
No.
Okay, now I will be asking you like this. Now make it together again. Okay, with the second hand please. Extend it. Okay, now make it together. Okay, great. Move your thumb to the base of the little finger like this. Okay, back to the normal. Again please, back to the normal with the second hand. Back to the normal. Again, back to the normal. Now I will ask you to touch the fingertips with your thumb. Okay. Okay, with the second hand. Do you feel any pain?
No.
Okay, now I will ask you to move your thumb away from the other fingers. Okay, with the second hand. Now I will be proceeding with the special maneuver test, which is carpal tunnel syndrome, in which we have two tests. Tinel's test. I will be doing Tinel's test first.
Yes.
Do you feel it?
Yeah.
Do you feel it? Yeah. Place your hand inwards like this. Okay, great. Thank you. Today I have examined a patient of age 52 years for wrist and hand examination. While inspecting his wrist and hand, there is no scars, lesions, and for palpation there is no edema or erythema found. While performing the range of motions, there is no abnormalities or pain occurred, and for special maneuver techniques, there is no lesions in the nerve. So the patient's wrist and hand is completely normal. Thank you.
Myself, Kumar. What is your name? How old are you? 22. I'm going to examine your age in supine position. First of all, right now I am inspecting your knees. There is no swelling, no damage, no atrophy. Now I am going to inspect Now I will examine your suprapatellar pouch. Right now I will examine your lateral and medial meniscus. Inspect your collateral, medial and lateral collateral ligaments. Now I am going to check your range of motion. The first thing is flexion. Please stand up and be on your one leg and bend the knee of second leg on 150 degrees. Okay, it's fine. Well done. Are there? This is flexion. This is extension. This is internal rotation. And this is external rotation. Clear. I will do some special movement. These are my positions. Are there? Like my test. Order.
Welcome. May I know your name and age?
My name is Naren, my age is 20.
I would be preparing the physical examination of cranial nerve. Is that okay?
Okay.
Before moving on the procedure, make sure your hand will be sanitized.
Okay.
So let's start with the examine of cranial nerve. Just close your one side of your nose. Do you smell it?
Yes.
Okay, close your another one. You smell it?
Yes.
Now I'm going to examine the wriggle test. You cover your eye.
Okay.
So just focus on my hand. Just close another eye. Now just focus on the top of the pen. So see my eyes. I just move my finger. When you are able to visible my finger, just say is that visible.
Okay. Visible. 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 Visible.
Hi, I'm Dr. Varun Shah and today I'll be performing some cranial tests on you. Can I know your name and date of birth, please?
Sharat Premarajan, 23rd March 2000.
I'll be performing 3 cranial nerve tests, that is the cranial nerve 5, trigeminal nerve, cranial nerve 7, facial nerve, and cranial nerve 8, that is the vestibular cochlear nerve, also called as the acoustic nerve. Alright, I'll be performing the sensory and motor functions of cranial nerve 5. Before we start the test, let's sanitize our hands. The first test that I'd like to perform is, can I ask you to clench your teeth so that I can check for your buccinator muscles as well as your temporalis muscles. The next test that I'll be performing is the sharp and dull object test. So I will be placing this on your head. This is the sharp object, this is the dull object. I'd like you to tell me if it's sharp or dull sensation. Okay, so can I ask you to close your eyes, please? Thank you. Okay, what is this?
Sharp, dull, sharp, dull, sharp, dull, sharp, dull, sharp, dull, sharp, dull.
Alright. The next test that I'll be performing is the corneal reflex test. I will be inserting this cotton in your cornea just to see your reflex actions. Alright? So, just a minute. Alright, good enough. The next test that I will be performing is a cranial nerve 7 sensory and motor function test. I want you to make facial expressions. So, can I ask you to smile? Right. Can I ask you to frown your face? Can I ask you to raise your eyebrows? And can you wrinkle your forehead? Can I ask you to close your eyes tightly so that I can try to open it? Okay, good enough. I'll be performing some sensory tests on you. So for that, I'd like you to protrude your tongue out, and I'll be putting some solution over it for you to identify what taste does it give you, sweet, salty, sour, like that. Correct? So can I have your eyes closed, and can you protrude your tongue out so I can place the solution over it? Okay. So can you taste that and tell me what it is? Sweet. Okay. That is? Salty. Alright. The next test that I'll be doing is the whispers test, in which I will be whispering something in your ear and I want you to say it loudly if you can hear it or no. Alright?
9x1.
Alright, good enough. The other side now.
9x1.
Alright. Test that I'll be performing is the Rennes test, in which I'd like you to tell me where you hear the buzzing sound perfectly. Okay? In position A or position B. Alright? Position A. That is position B.
Position A.
Alright, the other side. Position A or position B?
Position A.
Okay. So that is the Rennes test. The next is the Weber's test. So I'd like you to, I'll be placing this tuning fork in the center of your head, and I'd like you to tell me where you hear the voice. In the center, the left ear or the right ear, right?
Center.
Alright.
So here we place the glossopharyngeal nerve. Here I ask the patient to say a word. Here we see the soft palate of pharynx, and the soft palate is going properly upside and symmetrically, and the uvula is in midline. So here we do the vagus nerve, and for this test is gag reflex. So here we see the gag reflex is consist of the soft palate and the elevation of the tongue, and this is for the pharyngeal muscle. This is the nerve spinal accessory. Here I ask the patient to slug his shoulder against my hand pressure. Here we detect the trapezius muscle constriction and its elevation. So here we place the second test for the spinal accessory nerve. Here I will pressure against patient chin, and he will pressurize against my hand. So it is normal, and it is second chin.
The hypoglossal nerve mediates the tongue's motor functions, which in turn affect articulation of words.
So here we place the hypoglossal nerve.
Myself, Mr. Saurabh. My topic is cerebellum.
Hello, I am second year medical student. What is your name?
Jagati Mishra.
And date of birth?
12/6/2002.
Okay. Before I started physical examination, first of all, hand washing is necessary. So today we discuss about cerebellum, and the most common symptoms are ataxia. Observe the feet are placed close together as normally are wide. Normal individual stand at rest with little or no shifting of feet or movement of the body. If in cellular dysfunction, the patient shifts about the trunk wavily, unsteadily. In many instances, patients are unable to stand without support. Second symptoms is tandem walking. The patient to walk normally in the tandem. In a later, the patient are asked to walk with one foot immediately in front of the other. The next test is dysphagia. So I asked you to speak British Constitution.
British Constitutions.
It's okay. In this dysphagia, if the patient tells like British Constitution, that means incoordination in the voice, incoordination in the lips, tongue and larynx, that is called dysphagia. The next test is nystagmus. It is a cerebellar test. So first of all, you see my fingers in this way, in right side, slowly, and then in left side, then again in right side, If the patient have right cerebellar disorder, right cerebellar lesion, the eyes are horizontally right side and slowly drift in the left side. The next test in cerebellar injury is dysmetria, and dysmetria is most important test, and it results in overshooting or undershooting of a target while attempting to reach the object. Is dysbiokinesia, and in this case I have to tap your one hand on the another hand, like in this fashion. Okay, if the patient is not performing this type of movement, they are suffering from the dysbiokinesia. In dysbiokinesia, the rapid movement of the hand, supination and pronation of the hand is not occur. So the next test is finger nose test. So you touch your nose in this fashion from the both hand. Okay, it's too good. If the patient are suffering from cerebellar lesion, so they cannot perform this test. They touch instead of nose, they touch eyes, they touch mouth. The next one is finger nose test. I place my finger in front of you, and you touch your finger first on my finger, then your nose. Start this. Start this. Again. Again. Good. If the patient is suffering from the cerebellar lesion, so they cannot perform this test. The most important test is pendular knee jerk. In this test, a patient is suffering from the cerebellar injuries. They can swing forward and backward several times, actually more than 3 oscillations. But in a normal knee jerk, they swing forward and backward 1 times or little bit more than 1. The next test is rebound phenomenon. In this test, first of all, we hold the patient's forearm and say to the patient to flex the elbow forcefully and guard the patient's mouth from the other hand. And I released her hand suddenly. And if the patient is suffering from the cerebral injury or any cerebral lesion, the patient hand does not control and hit her face.
Hello, I am Dr. Rahman. I am going to examine you. Is it okay for you?
Yes.
Okay. Please let me know when you feel any sensation, okay?
Okay.
Please close your eyes. Any sensation?
Yes. 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 Yes.
Okay. Is this sharp?
Yes.
Sharp?
Yes. 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 Yes.
Okay. Please let me know if you feel any vibration, okay?
Okay.
Any vibration?
No.
Here?
No. Yes. 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 Yes.
Okay. This is the sharp object. Please let me know this the sharp object is 1 or 2.
Okay. 2. 2. 1. 2. 2. 2. 2. 2. 1.
Okay. Are you feeling any sensation?
Yes.
Any touch?
Yes.
Here?
Yes.
Here?
Yes.
Here?
Yes.
Okay. Please hold this. What is this object?
Coin.
This one?
Paper clip.
This one?
Key.
3.
Please let me know. Close your eyes. What is this number?
0.
What is this alphabet?
2.
2. This one is alphabet. A to Z.
Z. Z.
Okay. This one is down or up?
Down. Down. Up. Up. Down. Down. Down.
I am Shubhranil Manna, a medical student. First, I'd like to thank you for coming and helping me in my OSCE assignment. My OSCE assignment is motor examination of your lower limb. Sir, May I know your name and date of birth?
My name is Anish Mitro and my date of birth is 17th of November 1997.
Okay, thank you, sir. Sir, can you please lay down and pull your sleeves? Thank you. Now I'm going to go for an inspection. Okay, I'm going to check the bulkiness first. Now, sir, I am going to check the tone and reflexes. Sir, please make your legs floppy for me. Rolling your legs, sir. Now, I'm going to lift your legs. I'm not going to hurt you, but if it pains, please let me know. I'm going to lift your ankle up. Please make your foot floppy for me. Okay. Now I'm going to check your muscle strength. Please lift your thigh towards the ceiling. Okay. Now put your pressure upwards. Okay. Okay. It's okay. Same on this. 1, 2. Okay. Now put your pressure downwards. Okay. Downwards. Okay. Now pull your ankle towards your buttocks. Okay. Now put your pressure inside. Okay. Little bit upwards. Okay. Pressure inside. Okay. Now, kick this side. Okay. Kick this side. Okay. Now, pull your thigh inside. Push outside. Okay. Now, pull this side towards your face. Okay. Pull towards your face. Okay. Now, put the pressure on my palm. Put pressure on my palm. Now pull the toe towards your face. Pull the toe towards your face. Okay. Now pull your ankle inside. Pull your ankle inside. Push your ankle outside. Push your ankle outside. Now, I'm going to use a semi-sharp object. It might give you a tingling sensation. You got any tingling sensation? Okay. Is it? Okay. After assessing the patient, what I came to know that during the inspection, I got no scar, no muscle weakness, no muscle tone, no involuntary muscle movements, no tremors, and not even fasciculations. During the measurement, I got both the same numericals on both the legs. His muscle tone was normal and his muscle strength was normal during and all throughout the video. Thank you.
Myself, Logesh Ravi, second year medical student. May I know your name and age, please?
Good afternoon. My name is Geeta Ravi, age 44.
Okay, ma'am. So I am here for the motor examination of your upper extremities. So before getting into this examination, I would like to give you a brief explanation of this examination. where the first step of this examination includes inspection of your upper extremities, and second one will include the pronated drift and muscle tone examination, and the final third step of this examination includes the power testing of your upper extremities. Is this procedure fine with you, ma'am?
Fine, okay.
Okay, ma'am. So we will start with the first step of the examination, that is inspection. Okay, ma'am. So as per inspection of your upper extremities, it finds that it has normal muscle bulk in both your arms and forearms, and there is no evidence for any atrophy or fasciculations, and there is no observance regarding the abnormal movement like tremors. So we move on to the next step of this examination, that is pronated drift and muscle tone examination. First, we will get to the pronated drift examination. Can you raise your arm in this manner, ma'am? You can relax down your arms now. Okay, ma'am. So I can see that there is not any kind of pronated drifting of your either of the arms. So it reveals it is negative. So this signifies that there is no lesion in your corticospinal tract. So we will move on to the next examination, that is muscle tone examination. In this examination, I will rotate your wrist in a rotating manner and then eventually flex and extend your elbow joint. Same with the next hand, rotating your wrist joint and flex and extend your elbow joint. Okay, ma'am. So in this examination, I can find that there is no rigidity or spasticity of your either of the hands muscles. So here I will test your deep tendon reflex in a mid-pronated position of your hand. Okay, this is for reflex of supinator and brachioradialis muscle. Okay, now it will be for deep triceps tendon reflex. Okay, now for the fingers reflex. Okay, ma'am. Now I will perform the test for the Hoffman's test, wherein I will keep my index finger under the distal phalanges of the middle finger. Yeah, so I can see the Hoffman's reflex. Yes. So as we have done with all before the two tests, that is inspection and the pronated drift and the muscle tone examination, I will move on to the third and the last examination, that is power testing of your upper extremities. We will begin with the shoulder abduction adduction. Place your arms in this manner, ma'am. Yes. So put some pressure over your arm for the test of adduction and below your arms for the test of abduction. It's fine. I will move on to the examination of elbow flexion and extension. Put your elbow in this manner, ma'am. Yes. So there is a test for the extension of your elbow joint. This is test for the flexion of your elbow joint. Okay, fine. Now we move on to the wrist flexion and extension. Now place your wrist in this manner, ma'am. So yes, so wrist extension is good. Now place it in this manner, ma'am. Yes. Yes, wrist flexion is also normal. Now we will move on to the next examination, that is finger flexion and finger extension. Place your hands in this manner, ma'am. Yes. Now place your hands in this crawling manner, ma'am. Yes, fine. Now face your palm downwards and abduct your fingers. Yes. Okay. Now face your palm in upwards and bring your thumbs in and take it in the upward direction. Okay. Okay. Now, so we have done with the power testing of the upper extremities. It's completely normal, and now we move on to the examination of apraxia. We'll begin with the construction of apraxia. I will draw a structure, and you have to draw it in the same. Okay, so construction apraxia test is done. Now we'll move on to the dressing apraxia test. Where is code, man? Okay, so the construction apraxia examination is done to find that whether the parietal lobe lesion is there or not, and the dressing apraxia examination is done to find whether the non-dominant hemisphere of the lobe is affected or not. Thank you.